We told you at the top of the hour about a Walker woman who is in Pittsburgh right now. She's awaiting a double lung transplant. Anya Machaluski had to have chemotherapy to treat brain tumors when she was a baby, and that caused scarring on her lungs. And now she and her mom have temporarily relocated to Pittsburgh for that operation while her dad has stayed behind. A new program, however, we just told you about last week, may make it so that West Michigan families don't have to leave the area for a lung transplant like that family. Spectrum Health now has a program to perform them, and joining us now for more on that is Reda Girgis, Medical Director of the Spectrum Health Lung Transplant Program. Reda, thanks for coming in tonight.
Thank you so much for having me. It's a pleasure.
You sympathize for this young lady. I mean, she's in Pittsburgh. She's from here. She can't take advantage of this particular program yet just because of timing. But for folks in that kind of situation, they've now got this resource here at home.
Yes, and we're certainly very excited to provide that service for residents of Western Michigan and actually beyond. But it's obviously, these are very sick patients. They have advanced lung disease. The evaluation process to be assessed for their candidacy for lung transplantation can be quite involved, requiring several visits to the transplant center. And once you do get transplanted, centers like to have their patients close by for very frequent visits for the first 3 to 6 months and sometimes up to a year.
Sure.
And that can be, obviously a big burden on patients and their families.
Talk about the resources that are available here in West Michigan. We've got that heart transplant program. When that came in, we kind of brought this issue up, how valuable it is to have these kind of resources in our own backyard, what it means for this community.
Absolutely. I think it just takes up the level of medical services provided to the residents here to a new level. These both heart and lung transplantation are widely accepted therapeutic alternatives for patients with advanced heart and lung disease. And in terms of lung transplantation, the numbers are growing really every year. There are more and more being done nationwide. So the indications are actually being broadened out a bit. So it certainly is an important option to be available to patients and to physicians and their patients in this area.
Patients also have the option, if they've had this kind of procedure in another city, they can come back to Spectrum and continue their follow-up work here at home. That's huge.
We're certainly happy to work with transplant centers, other transplant centers, to help manage their patients that are in this area. We're happy to get involved as much as they'd like.
Yeah. What's on the, you don't put a number on how many transplants you expect to do in a year, but there has to be a minimum threshold to be able to get this kind of service in town.
Yeah, so our next hurdle right now is to get what's called Medicare certification, be certified by Centers for Medicare and Medicaid. And that allows us to be a recognized center for Medicare to pay for transplants for their patients. And that minimum is 10 transplants per year. And so that would be the minimum, but we're certainly, I think, given the number of patients, the population of this area, and the number of patients that we've seen so far, and the amount of donors that are available, I mean, we can certainly expect to do many more than that, perhaps 20, 25 a year.
Phenomenal. Yeah, what a resource. Reda Girgis with Spectrum Health. Thanks for coming in tonight. We appreciate it.
Thank you for having me. It's a pleasure.
Yep.